Hi, I'm Carolyn. I'm going to be your nurse. Going to do a head-to-toe assessment on you. We do a few things with each system. We inspect, look at everything, and percuss or palpate and auscultate and stuff. So, anyway, can I have your name?
Alyssa Yoder,
Date of birth?
5/28/94.
Okay, great. And can you tell me, do you have any health problems, or do you have a health history of any type?
No health problems.
Okay, any surgeries or injuries?
I injured my knees before, but no surgeries.
Okay, good, and they're working okay now?
Yeah.
Okay, and your vaccinations, immunizations are all up to date?
Mm-hmm.
Okay. You don't smoke or drink? Okay, that's good. And what do you do? What do you do for, do you work? Do you
Oh,
go to
I
school?
am a college student in nursing school, so
Yeah, good. That's great. Are you on medications for anything? Any allergies, meds?
Nope.
Okay, good. Okay, so we're going to start by looking at your eyes here. I'm going to check your pupils, see if they react to my light. Okay, just look straight ahead at something over there. Okay. Okay, and her pupils are intact. They're equal, reactive, round, and good there. And we're going to check for accommodation. So just follow my light here. Good. Her eyes move towards the center, and her eyes are to constrict whenever they're doing that. Okay, then we're going to check for extraocular movements of the eye. So follow my light when I move it here. Good. Okay, and those things that I just did are the cranial nerve 2, the optic nerve, and also the cranial nerve 3 and 4 and 6. So next I want to look in your mouth here and just open up, see okay, we're looking at teeth and gums, making sure there's no lesions or decayed teeth or any problems that she might have problems swallowing, and you're not having any trouble with your teeth or anything. Okay, and she's swallowing okay, no drooling is noted, so we're not going to test the gag reflex. If there was any signs that she may be having trouble with swallowing, then we would check a gag reflex. So we're going to skip the cranial nerve 1 olfactory nerve for smell, and next we'll go to the head. We're going to check the head, the scalp for lesions, and check the hair, make sure there's no bumps or lesions or anything, any loss of hair that would indicate certain diseases. She's good there. Next, we're going to move on to, we go back to the eyes and check the sclera and the conjunctiva. And we're just going to pull down the eyelid and look at the sclera. And her color's good. There's no paleness or yellowness to indicate anemia or jaundice. So we're not going to check the corneal reflex because of touching her eye. And that's part of cranial nerve 5. Next we'll go on to the rest of cranial nerve 5 and 7, which is the trigeminal and the facial nerves. So if you could blink, squeeze your eyes tight, good, and raise your eyebrows, smile real big, clench your teeth, and blow like a fish, blowfish, and pucker. Good. Okay. So those are all intact. She's good. Next, cranial nerve 11. We're going to have her shrug her shoulders, and try to resist me. Good. And you can turn your head that way, to the left and to the right, and then up and down for me. Good. So those are all intact and good. One thing I would have done at the beginning is would have got vital signs, blood pressure, and heart rate. But we'll be doing the heart rate along with the lungs and thoracic exam. So next is cranial nerve 8, the acoustic nerve, and we're not going to do the Weber and Rhine test, but I'll do the whisper test. So I'll stand beside her and have her close her eyes, and I'm going to whisper 3 words, and she is going to say it back to me, and if she hears me and says it, then that means that nerve's intact. Mm-hmm. So
cat, dog, fish. My cat is Leo.
okay. Good. I had trouble thinking of what to say. Okay. Sorry. Okay, so next we'll move on to the neck, and we'll check lymph nodes. Lymph nodes, we're going to check for symmetry, make sure there's no hardness, firmness, tenderness. So we're going to do the pre-auricular, the post-auricular, the submandibular, the submental, the anterior cervical, posterior cervical, and the occipital, and then the subclavicular. Yes, with supraclavicular. Sorry. Okay, so that's that exam with the lymph nodes. Then I'm going to check the thyroid by standing behind her and just feeling for my landmarks, the cricoid, the thyroid cartilage, and then we're going to move down here a little lower, and then I'm going to ask her to swallow and see if I feel the thyroid. Go ahead and swallow. Okay, good. And I didn't feel anything, which is good because you don't want to feel the thyroid, because that can indicate goiter or something that isn't good, or mass. So, okay. Next, we will. Oh, okay. While I'm here at the neck, I'm going to listen to her carotid to check for any bruits, and I'm going to listen with the bell of the stethoscope. Okay, and also for any JVD, which is better looking for when they're laying down, but that would be any kind of jugular vein distension, which would be prominent in patients with fluid overload. Okay, next we're going to go on to the arms and the vascular part. And I think so. Wait a minute. Why do I have that? Okay, yes. I'm going to go ahead and do this part of it. So I'm going to check pulses in her upper extremities here, the radial pulse. Make sure it's not thready or too bounding. The brachial pulses. Make sure her skin is nice and warm, not any hot spots, no lesions, no skin problems, fingernails look good, and check capillary refills, no good. So that's that part. And also you'll want to check and make sure that there isn't, that just the fingers aren't swollen, shiny, or don't have any hair, or they're tight, taut, which would indicate poor circulation. Make sure they're not cyanotic. And while I'm here, I just want you to grasp my fingers, squeeze real tight. Okay, so we're checking strength right there of the finger grasp. All right, and we'll go ahead and check the radial and the brachial pulses on this side. And check that arm and hand and fingers. Good. Okay, next we'll go on to checking our lungs, the thoracic and cardiac part of the assessment. So with assessing the lungs, we want to look at the breathing. We want to inspect first, make sure her breathing rate is within the normal limits. Make sure it's not irregular. Make sure she's not trying too hard to breathe, the effort's not too hard. Make sure there's no nasal flaring, any kind of fear in her eyes that she would be having a hard time breathing. So, okay, then we're going to listen. I'm going to auscultate for several places, anteriorly and posteriorly, and what I'm listening for is wheezes or rails, rhonchi, any adventitious sounds that shouldn't be there. Okay. So we're going to start up here. I'm going to ask you to just take a deep breath and let it out. Let it out normal, okay? Go ahead. Okay. Again. Oh. Okay, again. Okay, and I know I don't want to listen over any bony prominences, and I want to try and listen in between the ribs. Okay, again. Down here, go ahead. I don't have to do too much. Again. Okay, if you could just lift your arm up and we'll listen over here. Oh, shoot. I thought I have to listen on the skin. Sorry. To listen directly on the skin, I know that. Go ahead. Okay, good. While I'm in the front here, before I move to the back, I'll go ahead and palpate for any kind of tactile fremitus, which is just placing my hands in areas and then have her repeat 99 and make sure the vibrations are equal on both sides. So I'm just going to go ahead and feel right here and say 99.
99.
Okay. And I think that's the only place I'll do on the front. We'll do more on the back. Okay. So if you would go ahead and turn around for me. Okay, we'll continue listening to lung sounds. Just gonna go up by there. Okay, deep breath. Out. Good. Okay. And then we're going to go right medially of the scapula. Okay, then down a little bit here. Go ahead. And then down one more. Okay, we'll do one more here. And whenever you listen, we go side to side to compare sides instead of down one side and then down the other, because you want to compare the sides at the same time so you know if they're equal. Unequal breath sounds could indicate atelectasis or consolidation, or indicating like pneumonia or COPD or some type of lung problem there. Okay, then next we're going to go ahead and do the vocal and tactile feminist test here. So I'm going to just put my hands here in the land markings and check these by having her say 99. Okay, say 99.
99, 99, 99, 99.
Okay. And I'm going to go back to this again and do the egophony. I'm not sure how to say that. Where we're testing where she says E, and I'm going to listen to see if it comes out as an A, meaning that there might be some like consolidation or some type of problem on one side of the lung. So,
I'm saying E.
okay. Oops, I can't get under there right.
Am I saying E?
Okay, can you say E?
E. 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 E.
Okay, and it sounded like E to me the whole time. Okay, next. And I did not hear any wheezing or anything with the lung sounds. They were clear, equal bilaterally, and she doesn't have any extra effort to have to breathe. No retractions, no use of accessory muscles. The rate is good. So next we'll go on to cardiac. We'll listen over the heart, the different areas, which are the PMI. Yeah, go ahead and turn around for me. Point of, I forget what that stands for. But okay, then we're going to listen to over the aortic, the pulmonic, and the tricuspid, and the mitral parts of the heart, and Erb's point. And when I'm done listening with the diaphragm, I'm going to listen with the bell also, so I can make sure I don't hear any bruits or, well, basically any bruits, and listen for the S3 and S4, the extra sounds. So, okay. Okay, and these are at the second clavicular rib. So we'll listen to the aortic. And this is the pulmonic. Okay, then
Let's do what you're gonna do.
huh, just go under. And then we'll do I'll just under this one. Erb's point is at the mitral valve, which is at the fifth clavicular. So this is where the apical heart rate would be. So we'll listen there. And then the tricuspid is at the fourth clavicular rib, like right in here. And we're listening for murmurs. Make sure the rate's good. Make sure the rate's regular. The rhythm's regular. It sounds regular. And with the bell, we'll go ahead and listen with the bell over the same areas for any bruits. Okay. and that sounds good. Okay, next we're going to move on. Next we're going to move on to the abdominal assessment, so I'm going to carefully have her lie down here. Okay. Okay. So first we inspect. Sorry, inspect the belly. Look for any kind of like scars, any skin problems, scars which would indicate previous surgeries, any kind of irregularity of any protuberance or anything like that. Then we can listen for bowel sounds before we palpate because of causing hyper bowel sounds if we palpate first. We're going to listen in 4 quadrants. And I hear hers fairly quickly. Okay, and then we're just going to kind of lightly palpate and feel for any tenderness and any kind of masses. Okay, then for the liver, sorry, she's ticklish. I'm going to have her take a deep breath, and then I'm going to palpate and see if I can feel her liver. So go ahead and take in a deep breath. Okay, go ahead and let it out. Okay, so what we're feeling for is for the liver to come down and bounce on the tip of your fingers there. And then the spleen is over on this side, and basically the same thing. You want to go ahead and take a deep breath. Okay, let it out. Okay, and we don't want to feel the spleen because if we do, that means there's a problem if it's enlarged. So, and let me see. Try to hit everything. Okay, now I want to listen for the aorta right above the belly button. Make sure that I don't hear any bruits. I'm going to use the bell. Okay. And we don't want to hear any bruits because that would not be a good sign. Okay, let's see. Next, I'm not going to do it on her because she's not in a hospital setting, but we would feel for the femoral artery and the inguinal lymph nodes at this point. Make sure that they're intact and palpable. Okay, so if you can sit up for me again. Next we're gonna do we're gonna do deep tendon reflexes, which is part of the neuromuscular exam. So I'm gonna feel for the tendon here and do the brachial. Oh, this is the bicep, sorry. Okay, this is the tricep. Oh. And this is the tricep. It's kind of hard to do it like this. we get the point of it. Alright, we'll go ahead and do this. And the bicep here. And the radial. Okay, and then we'll do, this is the patellar. Okay, and then we'll do the calcaneus, which we'll, it's right behind the Achilles there. Okay, so deep tendon reflexes, as long as they're not hyperactive or whatever, we're good. So next we'll do, while we're with the feet, we'll check our pulses down there, and we'll look at the feet. If it's a diabetic person, then we got to check for circulation, check for any kind of ulcerations, make sure the nails are okay. So we're going to check for the pulse here at the pedis thoracic on both feet. We're going to check the toes for temperature. We're going to check for proprioception of the toe to see if she can tell which way I'm moving the toe when her eyes are closed. So can you close your eyes and tell me if I'm moving your toe up or down, okay?
Up, down, down, up.
Okay, good. Okay, next we're going to do vibratory sense, where we check and see if she can still feel vibrations in her distal extremities, since it's the first thing to go whenever your neuro it starts going. You feel that?
Mm-hmm. Yep.
Okay, so she feels that, so we don't need to go further up the joints there. And can you, okay, we'll do the Babinski reflex. And she has a reflex there. And then we're going to check for, while we're down here, the I'm not sure how you say it. What's it called? Just give me a second. Oh, it's the one. Just give me a second, it's okay. It's to check for what is it? It's that big long word. The dio. Oh, it's right here. It's the it's that big long word. Look on it. Okay. Well, what we're gonna do is have her take the heel of her one leg and slide it up, slide it up the shin of the other leg. So go ahead and do that. See if you can do that. Good. Check that. And this is the check for coordination, to make sure that she doesn't have any lesions like in the frontal lobe or the cerebellar part of the brain. And we are gonna next, while we're down here, we might as well do this part. I'm gonna do extension and flexion of the lower extremities and have her and oppose them. So I want you to bring your foot out, and I'm gonna push against it, okay? Good. Good. And bring your leg out, straight out for me, and try to, okay, and do that one. Okay, good. Okay, so she has good strength and equal strength in both legs. And next, I get everything down here. Oh, hold on, I forgot to do. Alright, so I'm going to have you go ahead and stand up for me. And if you can stand with your arms out, palms up. Okay, close your eyes. And just keep your eyes closed. We're going to see if one arm drifts down, which would indicate a pronator drift, which would be a neuro injury to the brain of some sort. Okay, you go ahead and put your arms down for me. And okay, I'm going to have you put your arms straight at your side, and when I ask you to put it out straight, I'm going to go against it, okay? So go ahead and put this one out. Fight it. Okay, watch out, go ahead. Okay, good. Can you go like this and shrug your shoulders? Okay, and then do it again. Okay, good. She has good strength, equal. And then also, okay, I'm going to have you close your eyes and take your finger and touch your nose. Good. Now open your eyes and touch my finger. I think you have to touch your nose. Touch my finger. Keep doing it. Where? Okay. Okay, so you're intact there with coordination. And also, whenever we're looking at muscles, the musculoskeletal, we want to look at the joints, make sure there's no swelling, deformity, pain, tenderness, warmth, and muscles, we want to look for any kind of atrophy, unilaterally, if there's some on one side and not the other. So, those are just some things that we want to look for. And this is the test I was thinking of earlier, the diacokinesis test, which is the one that can, if it's abnormal, can be a result of lesions to either the cerebellar or the frontal lobes. Okay, so we did the straight down the shin. Next we're going to do the Romberg's test, where she's going to stand with her arms at her side, feet straight down. Close your eyes, and we're just going to watch her for a minute here and see if she loses her balance. And when she opens her eyes, we're going to be ready in case she does lose her balance. So go ahead and open your eyes. You okay? Okay. Next, let's see. I'm going to have you walk on your heels for me. Okay, good. And then walk on your toes. Okay, good. She has good coordination, good strength, good muscle use there. And next we're going to test. Oh, there was something else I wanted to do. Can you put your fingers on one hand and then do the other one? Okay, so we can do the finger to palm. So next we're going to check the gait. And if you want to walk across the floor for me, we're checking for balance, smoothness, make sure she doesn't have any shuffle or to her feet or tremors that would indicate her being a fall risk. And she did well. So, or any limping or knee weakness that would indicate problems also. Okay, next we're gonna, I forgot to do this with my back exam. I would want to check her spine and posture, so I'm gonna ask her to bend over and touch down there, it's close to the ground, and just check her spine, make sure it's straight, make sure there's no asymmetricalness to the scapulas indicating like scoliosis. And also, I want to check for CVA tenderness over the cost of our vertebral angle, which I would just push and then kind of percuss over that, which would indicate some flank discomfort there and pain. So I think that sums it up for me, and I thank Alyssa, and just to make it known she's my daughter. So thank you very much. Thanks.